All right, tonight we've got a guest from Robert Wood Johnson University Hospital. We have Andrew Thomas, who is the interim director of care transitions. Now, these are these fancy words that hospitals use now, and we're going to find out just what that is. Mr. Thomas, are you there?
I'm here, Dr. Perry. How are you?
All right. So, great. Thanks for taking time on your Saturday evening. So tell me, what is the care transitions? What's that all about at the Robert Wood Johnson University Hospital?
Well, as you know, the healthcare landscape has been changing a lot, and now the most major payer of healthcare, the Medicare and CMS, which is responsible for Medicare, is actually asking hospitals now to make sure that patients do not come back to the hospital when they are discharged, especially coming back within 30 days. So Robert Wood Johnson University Hospital, and most of the hospitals probably, are actually implementing things to make sure that patients transitions appropriately to home, making sure that they have exactly what they will need to prevent them from coming back to the hospital.
So it's not that the hospitals don't want patients, but what is happening at a federal level is that the federal government is doing whatever it can to kind of shape medical care to the benefit of patients so that while they're in the hospital, they get certain treatments and certain things are done, like a pneumonia shot, for instance, right? So that it decreases the chance of a problem once they're discharged. So, in some ways it sounds kind of funny. Well, the federal government doesn't want you coming back. That's not it, right? That's not exactly what they're saying.
That's partially part of it. I mean, the paradigm is actually shifting a lot now. The hospital is not going to be the center of all the treatment that patients get. It's true that, yes, we want them to have the best care in the hospital, which is you're absolutely right with that. But also we do great care in the hospital. But what happens if we discharge the patients home? And what happens outside the hospital, we really do not know. For instance, somebody comes in with a heart attack, we put whatever thousands it will cost of stent in the patient. But to keep the stent open, you need dual antiplatelets. You'll need aspirin and another antiplatelet. And if the patient goes home and they cannot afford those medications, which usually cost maybe $20, $30 a month or less, the patients get what we call instant restenosis. The stent closes, they get another heart attack, and they come right back to the hospital. So somehow we'll be missing that step, which is actually making sure that when I take care of a patient, they go home, I also am responsible for that patient, making sure that they understand what they need to do, and actually making sure one of the most critical and difficult part is making sure that they can afford what we actually prescribe for them.
So how does Robert Wood Johnson University Hospital, how does the hospital do that when a patient then gets discharged? How can you assure that a patient is going to take their medicine and then follow up, let's say, with their appointments? How do you do this?
Well, actually, we start when the patient comes to the hospital. We have a transitional care department at Robert Wood Johnson University Hospital. This was actually influenced by our participation in the State of New Jersey's Delivery System Reform Incentive Payment, which is just a fancy term from CMS requiring hospitals or the state actually requiring hospitals to change the model that we use for taking care of low-income patients from just fee-for-service to actually fee-for-improvement or fee-for-value now. So we get a list of all low-income patients who are admitted to the hospital. So we see them. The first thing we do is reach out to the patient. Most of these patients, especially the low-income patients, do not have a primary care provider. Some of them don't. So we provide, which I consider probably the most important thing, is a number, a phone number for the patient to be connected with. The patient uses that once they're discharged, they have any questions, guess what? They have a number they can call. The other scenario is if they do not have that number, they come right to the emergency room. So that creates that vicious circle of a patient being treated, go home, they don't have somebody to follow up. So that's the one thing we do. And secondly, we do what we also call, part of our team involves a nurse practitioner who sees the patient while they're in the hospital. We have a pharmacist who reconciles the medications while the patient is admitted and are discharged. We have a social worker who takes care of the social needs of the patient. And we have a PI coordinator who actually collects all the data so we can make changes if it's needed. But another very important thing we do is what we call soft medical management. We actually look at the patient's medication or the treatment and actually talk to the physicians and say, hey, this patient cannot afford this medication. Can we change to another equally good, generic, but a cheaper medication? And usually it's a yes. And, so that kind of management we do. We do not manage, but we look at the patients and do that. And once the patient is ready,
and these are such wonderful measures, Mr. Andrew Thomas, who is the interim director of care transition at Robert Wood Johnson University Hospital. That's who we're speaking to tonight about what happens. Not just in the hospital, but when you get discharged from the hospital, you're not going to be just dropped off on the curb in front of your house by Robert Wood Johnson University Hospital. You're going to be managed by a whole team. This is very impressive, with a social worker, a pharmacist, a nurse, and that all important phone number. So I really want to thank you, because I learned something tonight, a little about the process that is going on and how people stay healthy at home. Well, thank you so much, Andrew Thomas. I appreciate your time this evening. My name is Dr. Arthur Perry. By the way, Robert Wood Johnson has an 800 number, 888-MD-RWJUH. That's 888-MD-RWJUH. They've got a great website, www.rwjuh.edu. That's rwjuh.edu. If you need a doctor in any field, from your toes to your nose, you've got Robert Wood Johnson University Hospital in New Brunswick, New Jersey. Thank you for listening tonight. We'll be back 7 p.m. next Saturday night. I'm Dr. Arthur Perry, plastic surgeon. Have a great week, and don't forget your sunscreen.